Hello, my name is Jesus Pina, and I'm working with Michael Zenchuk on the Dr. Death Project. I will be answering, should doctors be criminally liable for mistakes made in healthcare? Should others be imprisoned as well? And negative consequences to this. I think, like anything, there should be levels to this. Medical practice already tries to follow the 4Ds of to not do malpractice. But anyways, the first level would be like a minor case where a doctor thinks a patient is fine, but they aren't fine and they ultimately pass away. As long as the doctor acts in good faith and takes the judgment with facts behind it, then I think that is fine and there shouldn't be any consequences. Maybe a small fine, as there could be an argument that um, the doctor should maybe taken a second opinion or maybe gotten more facts related to the patient, etc. It gets to the next level or maybe criminal when the doctor isn't acting in good faith. We can look at an example I found on the internet. This doctor named Dr. Inagur let his elderly patient stay at home, but an associate of his told him that the patient should be taken to the hospital immediately, but the doctor didn't listen and thought that the patient was going to be fine, which led to the patient dying. So I think this should be a fee or some prison time. Um, he was acting in good faith, so a fee would be better because he ultimately really thought the patient was going to be fine, but at the same time did not listen to his patients or his associate. So I think this would be the next level. He did get a year in prison for doing this, but the governor of New York, I believe, let him do 6 weeks in prison and got him to do community service because the governor said that he would rather a doctor do some community service over serving jail time. So again, I think that doctors that aren't acting in good faith should get a good fee or some jail time. And now we're moving on to the next level. These are actually criminals who are willingly hurting their patients or pretending to be doctors. A good example would be Dr. Death. Um, these types of doctors who should be getting big criminal sentences, just like Dr. Death did. And if people are getting hurt because of this doctor, I think other people should be liable as well. For the example of Dr. Death, the hospital did not want to share that Dr. Death was a bad doctor and held this information out for others to see. So they're also at fault here. Of course, there's an argument that you don't want their their image to be tarnished, but at the same time, you're trying to save patients, right? That's their most important rule to follow. I also think people that help Dr. Death or doctors in general that are this bad, who gave him like his medical license and like um, who was his quote unquote master, um, should be held responsible too because um, this also helped, for example, again, Dr. Death to be where he was at. It was said that Dr. Death only had like 100 surgeries done when normally it's like over 1,000. So like whoever let him work in the first place as this type of like surgeon should be held responsible. The only consequences I can think of would be wrongfully incriminating a medical professional, because deciding if a doctor acted in good faith is a pretty difficult thing to do. So, um, of course, you can wrongfully incriminate somebody when they were acting in good faith, but the jury decided to go the other route. Um, Again, I think another negative would be tarnishing the hospital's name, but you gotta look at um, saving the patients as the ultimate um, goal to say. Um,
Whenever you go in for surgery, you want to make sure the doctor operating on you is going to ensure you come out better than you were going into it. With that being said, how can we ensure this outcome? There's no 100% way to ensure successful surgeries. Doctors make mistakes, some surgeries are riskier than others, and sometimes there are unseen circumstances that result in bad outcomes. What sort of quality control methods can be put in place to reduce poor outcomes? You don't want to set in stone methods of doing surgeries and potentially tie a doctor's hand on how they can or cannot do their job. You also don't want doctors to be able to do anything they want while you're on the table in the operating room. In the end, what can we do to reduce risks in the medical community? For starters, the medical community should be better connected, so that establishments hiring doctors have a better understanding of who they hire. In the case of Dr. Dunch, he kept getting new job offers after being terminated and continued to maim and kill people. His reign of terror could have easily been put to an end much sooner if hospitals communicated his past performance in surgeries, which begs the question, were none of Dunch's former superiors contacted whenever he would apply for a new position? The podcast states that causing a doctor to lose their license entirely is difficult and expensive, so firing Dr. Dunch was a much simpler solution. Why is this the case? Shouldn't the medical community make it easier to take licenses in obvious situations? When it comes down to it, better communication among medical establishments could go a long way in keeping out people who perform poorly and become a risk to their patients. Another quality control measure to take on doctors that may seem quite obvious is to make sure that they are not drunk or high while in the middle of the surgery they're performing. As of 2018, there are no federal regulations in place requiring regular drug testing of doctors or nurses. While assuming that the majority of doctors are not abusing substances while on the job, is that assumption enough when taking into account another human being's life? Just one doctor, like Dr. Dunch, could be out there abusing substances and causing serious harm or death to patients. Whether or not Dunch's drug abuse was the cause of his behavior towards other doctors, nurses, and performance while in surgery, he probably would have been a better doctor while sober. With all that being said, would requiring medical professionals to undergo regular tests be better in the long run? I would say it would probably be beneficial in ensuring that doctors are working at their full capacity. The last risk management control I think should be implemented is finding ways to make sure doctors like Dr. Dunch don't slip through the cracks. According to the podcast, Dunch only completed 100 surgeries during his residency in total. According to the American Board of Surgery, residents are required at the very least to complete 850 operation procedures across 5 years in the residency program. Clearly, Dunch did not meet that requirement. I think hospitals need to be able to access proof of residents completing the necessary requirements, or else it becomes much easier that doctors like Dunch are able to slip through. While Dunch was widely praised by most of the people he worked with and went to medical school with, one wonders, is it better to have a doctor who is seen as a likable person, or a doctor that has proven on numerous occasions their ability to complete the surgery they are working on? Even with all the advancements in the medical community, especially in recent years, we still need to keep on working to make sure that patients are getting the best and most safe treatment that they can possibly get.